Thanks everybody for coming. Hopefully I will be kicking off this year's topics in DD and convince you that the rest of them will be very interesting as well. And so I'll be talking with you today about my research program over the last several years and a little bit about where I'm hoping to go forward with it. As Dr. Haverkamp said, I'm interested in early intervention for children with autism spectrum disorders, and particularly in the family component of early intervention, how we involve family members in a way that is both beneficial for our children who have autism spectrum disorders, but that's also mutually beneficial for everyone involved in really improving family functioning and adjustment and mental health in the entire family and not just focusing on our kiddos with autism. So just to give you an idea what I'll be talking about today, I'll start out with talking a little bit more about what I mean by a developmental contextual approach. Then I'll move on to talking about a couple of studies focusing on siblings of children with autism spectrum disorders and thinking about how we move from an existing intervention program to expanding outward to involve family members and to think more about how that program may have an impact on family members. Then I'll kind of take the opposite approach in my next set of studies that I'll talk about, and really moving from what do family interactions patterns look like in families of children with autism and families of children with typical development, and how can we use that information to better inform the interventions that we're developing. And finally, I'll conclude by talking a little bit about my thoughts on how this approach to intervention can better inform our intervention development for children with PH.D. and as well as for their families, and what's most effective on a broad level for these families. So to start out, I'll talk a little bit more about what do I mean by a developmental contextual approach. And I really think of this as involving a lot of different pieces of intervention working over developmental time. So we know it's important to think about our children's characteristics and skills. Children with autism spectrum disorders are unique in some ways in terms of their skill profiles. We know that social skills, things like joint attention, early language and communication development are real challenges for these kids. And we also need to think more also about the individual skill profiles of the children we're working with, that there's been an emphasis in recent years towards trying to tailor interventions to particular children given their characteristics and skills. It's also important to think about, okay, well, interventions. What interventions are we using for these kids then that are informed by those characteristics and skills of children with autism? There are a lot of different interventions out there targeting autism spectrum disorders and those different symptoms. They range widely in terms of structure, in terms of the skills that they're targeting, in terms of who's involved, how often are they being delivered. So kind of as we're sorting through all of those different things that are involved, how does that play into this model? One thing I'll be focusing most on today and that my research focuses a lot on is family characteristics. How does that play into this whole thing? Because we know that we may have a great intervention that's perfectly targeting our skill deficits of a child, but if our families aren't feeling like it's doable for them, if they don't feel like it's effective, that's not going to be as helpful for our kids because parents aren't going to want to involve their child in an intervention that they don't think is effective or helpful or that's targeting things that are important for families. We're often asking family members to become involved in intervention. So if it's something that it might be the best intervention in the world and we want parents to deliver it, but it may be really difficult for parents to learn and to implement. If our parents aren't able to do what we're asking them to do with kids, it's not going to be effective either. And also if we're choosing interventions that are so stressful or hard on families that it is having a negative effect on family functioning in general, that may be good for our kids with autism in some ways that we're working on their skills, but bad for them in other ways because their family isn't functioning at as high a level as it could have. So that's something I'll really be talking about a lot today in terms of how that family component interacts with these other pieces of intervention that we're trying to work with for our kids with PH.D. And finally, I think remembering that this is all unfolding over the course of developmental time, both in terms of age of our children, that for children at different ages, different types of interventions are going to be appropriate. Also keeping in mind that for kids with PH.D. and for kids with disabilities in general, that developmental time and chronological time may not proceed at the same rate. We may have, for example, a 14-year-old who is functioning cognitively and language-wise at an age-typical level, or a 14-year-old who's functioning in terms of cognitive and language skills closer to a 2-year-old developmental level. Those two children are going to need much different types of interventions that we're working with them. And also, I think thinking about developmental time of a family. How are parents and other family members coping with diagnosis? When did they learn this information about their child? How much intervention has already happened with this child in the past? Where are we at in this child's life in terms of thinking about moving away from the home, for example, for transition age youth. So kind of keeping this full model in mind here, I'm going to move forward to talking a little bit about some studies about siblings of children with autism spectrum disorders, and starting with an existing intervention and taking that and moving out towards involving family members, particularly siblings in that intervention. So really my first big question with this study was, can an existing social communication intervention be effectively implemented by siblings of children with autism spectrum disorders? So thinking about the particular intervention we're starting with here, I used an intervention called reciprocal imitation training. It's had some early research on it. It's a naturalistic developmental behavioral intervention targeting imitation and social communication skills. So imitation and social engagement are the primary skills targeted. The intervention structure is that it's a focused intervention, really looking at particular targets. It's not meant to be a comprehensive intervention package. And it's designed to be relatively low intensity at 2 to 3 hours a week. And as I said, the intervention philosophy is sort of a blend of developmental and behavioral techniques, and I'll talk a little bit more about what that particular intervention looks like in a few minutes. So then thinking about involving family in this intervention. I really feel that siblings have a potentially unique value as teachers for their siblings with ASD. We know that sibling relationships are often the longest relationships in an individual's life. Siblings spend a lot of time with one another in a lot of different settings throughout their life. And that we know that peer interactions are oftentimes more difficult for kids with ASD than interactions with adults. So while siblings are going to be a slightly different age than our children with ASD, that may more closely approximate peer interactions in comparison to interactions with parents or with teachers. I think there's also a potential benefit for the siblings who are typically developing, as well as our siblings with ASD, in becoming involved with intervention. Know that having positive sibling relationships is something that we want for all of our kids, and that if being involved in intervention can help to build those relationships, it can potentially be mutually beneficial for both of the siblings that are involved. So really looking at kind of taking this reciprocal imitation training and moving it into involving siblings as our intervention providers. In terms of the particular skills that are targeted here, joint engagement and imitation are the skills that we were looking to hopefully improve with this intervention. So reciprocal imitation training, I'm guessing this probably isn't something that people are familiar with too much. It's work done by Brooke Ingersoll. And so there are 4 main components of this intervention. These graphics are actually taken from our little sibling treatment manual. But it's a relatively simple intervention, which is one of the reasons we chose it for siblings. So the first element is what we call contingent imitation, which is just imitating everything that the child does in order to try to create a context for imitation and to promote joint engagement. So as we put it to our young siblings, to copy your brother. The second element is linguistic mapping, which is just providing a running commentary at the child's language level of what they're doing, labeling things that the child is interested in, actions, toys. So as we put it for them, just talk to your brother, describe what's going on in the play interaction. Then the next step, and this is kind of, these first 2 pieces are kind of our developmental pieces of really that developmental context, providing a lot of language input, promoting joint engagement. And then these second 2 pieces are more of the behavioral components that come in. So we're asking the siblings then to model new actions for the child to do during play. So to show them something that may be a slightly more advanced play skill. So for example, if our child with autism is sitting here banging 2 blocks together, the sibling might model having them stack the blocks. And then finally, if the child with autism doesn't follow through with imitating, we have the siblings do some physical prompting, some hand-over-hand prompting to have the sibling with autism follow through. So as we put it for them, to help their brother to copy them, which I'll say the siblings did an impressively good job at doing this very gently and nicely with their siblings, which was good to see. So we're really looking at creating that context for joint engagement and then doing a little bit of modeling and prompting interspersed, particularly for imitation of play actions. So the study design, we had 4 children with ASD participate. They were all between the ages of 3 and 5, and 6 typically developing siblings. So we had 2 families where 2 siblings participated. The older siblings were between the ages of 8 and 13. We had some siblings who were slightly younger than that participate in our pilot testing. We had a 6-year-old, and felt like that was just a little bit too young for her to get the idea of the intervention and to really participate fully. That think there was a little bit more frustration and more difficulty understanding why we were asking her to be so understanding of her brother who wasn't very much younger than her. But I think that the appropriate age appropriateness may vary depending on the characteristics of that sibling too. Is that one of the other families that we had 2 older sisters participate, that there was a 6-year-old in that family who I think probably from watching her could have done a really nice job as well. So I think it's going to be variable. They each had 10 weeks of treatment that consisted of half-hour long in-home sessions twice a week. So what that looked like is I would come in, typically review some of the information with the sibling. We had a brief sibling manual. At times we did some role play back and forth with me and the sibling, pretending to do the techniques, and then I would coach them working with their sibling for about 10 minutes. And the skills were taught to the siblings in 4 phases that consisted of each of these skills that I had laid out. More so for the siblings to have a chance to practice and learn skills over time, even though it's really meant to be delivered as a full intervention package. So this was really for sibling learning. We used a multiple baseline design across dyads. So I know there may be varying familiarity with multiple baseline designs among the group, so I'll talk a little bit about what that looks like. So the idea of a multiple baseline design is that we use children essentially as their own controls within a treatment. It allows us to look for treatment effects in a very small group of children. So we just had our 6 dyads here. So the idea is that each child goes through a baseline phase where they have a number of sessions where we're not doing any active treatment. So for our siblings, this looked like just asking them to play together as they usually would, and we videotaped that. For each dyad, we have a different length of baseline. So for example, in this, I wish all my single subject graphs looked like this. In this very beautiful, perfect graph, we have about 5 sessions, and then this one's about twice as long and about 3 times as long. So we had varying lengths of baseline. And then that treatment gets started at different times. And the idea is that if we're able to see that in baseline, children's behaviors are relatively stable, and then it's only when treatment is introduced that we start to see an increase in their behavior. And regardless of the length of baseline, what we're looking for is a stable baseline, and then when we introduce treatment to see that change in behavior. So this gives us some control in terms of maturation, that we're not just seeing our children improve, for example, because we've been asking them to play together twice a week, and not because of the actual treatment that we're doing with them. So the first outcome I was interested in looking at was whether siblings increased their use of intervention strategies. We're asking relatively young children to be able to participate in this, and the question is, can they actually learn to do these things effectively with their siblings? When I did my data analysis for the published version of this paper and really looking at treatment effects, I analyzed graphs looking at them this way, so looking for that change over time. Presenting 6 single subject graphs on PowerPoint is a nightmare, so to make things simpler just for the presentation, I'm presenting things in terms of bar graphs. But in terms of interpretation, that I'm asking you to trust me that the single subject graphs looked similar in terms of changes to the bar graphs. Yep.
Can you just clarify what the y-axis is measuring?
So basically, you'll see here, this is going to be the rate of some type of behavior that we're looking at, and then this is looking over time. So each dot represents a different session, and then this, so say we're looking at language behavior, maybe this would be the number of times that the child spoke during the session. And so over time, we're seeing during baseline, they're not speaking, and then we start treatment and they're speaking during the session. But for different, and there are a number of different behaviors that I tracked during it. So I'll talk about exactly what I scored on these things. So for the purposes of this is each set of bar graphs represents one of the children who was involved. The blue here is their rate of the behavior during baseline. So those sessions where I was just asking them to play together. The yellow is the rate of behavior during those treatment sessions, that 10 weeks of treatment. And then the red is a follow-up session that was approximately 1 month later. So for this, first thing I wanted to look at is how are our siblings using those first 2 kind of engagement strategies, contingent imitation and linguistic mapping. So the way I scored this was the percent of intervals that they used these strategies during. So separated 5 minutes of videotaped interaction into 10-second intervals and said, how many of those 10-second intervals did the child use this strategy at least once? So we saw is that for all 6 of our siblings, they increased from their rate of using these strategies during baseline to their rate of using the strategies during treatment. So we're seeing them increasing their use of strategies here. During that follow-up session, 4 out of our 6 dyads maintained that increased level of using those strategies. So this was a set of strategies that for the most part our siblings did seem to be learning and using. We didn't necessarily see them using them as frequently as like an 80% cutoff or something that we would use in treatment, but we're seeing them doing it significantly more than they were doing prior to the training. Then this is looking at prompting imitation. So we're asking children to model some things and then follow through with a physical prompt if needed for their sibling. So what we saw is that siblings were hardly ever doing this during baseline, really. We saw very little of this behavior. But for 5 of our 6 dyads, we saw an increase in that prompting for imitation during our treatment period. And for 3 of the 6, we saw that maintained at follow-up. So we didn't have as good maintenance of these skills at follow-up, but I'll say we put kids to a pretty high standard in determining what counted as prompting for imitation, that in order to get scored as doing this properly, so this is just a rate per minute of prompting here. But in order to get scored as doing this properly, they had to correctly model an action, they had to give the child with autism up to 3 chances to try to do it, and then they had to either, if the child imitated correctly, provide praise for that correct imitation. If they didn't imitate correctly, they had to follow through with a physical prompt to have the child imitate. So in order to get scored as doing this procedure correctly, the sibling had to string together all of those things within one prompt. So this was a pretty high standard that we were asking our 8 and 9-year-olds to do. So the fact that we were seeing some increases for almost all of our siblings was nice to see. They were able to string this whole procedure together at times. And like I said, we had a little bit less maintenance of these skills for our kids though. So we're seeing some increases in siblings using these skills, but then the next question is that actually translating to increases in the child with autism using skills during this play interaction? So this is our overall imitation during play sessions for our kids with autism. So I scored this as a % of opportunities because we were seeing that at times different siblings were modeling more actions for the child with autism to imitate than others. So looking at out of those times that our older siblings were giving an opportunity for the child to imitate, how often were they following through and imitating that behavior? So we saw for 4 of our 6 dyads that we saw some increases in imitation over time during that treatment phase. And interestingly, for 5 of our 6 dyads, we saw some increase at follow-up, that Chris and Melissa here, even though he slightly decreased his imitation during treatment, that when we came back and did it a month later, that we were seeing him use that skill more. And so that's something that we saw not quite as, where am I can't get it to go backwards. All right, not quite as robustly. And interestingly, that we saw Ryan and Mark, Mark decreased his rate of imitation, which I suspect has to do with that % of opportunity scoring, is that our sibling Mark got a little prompt happy during treatment. He got so excited about getting his brother to imitate things for him that he was doing lots and lots and lots of trying to convince brother to imitate things. And I think that our kiddo with PH.D was getting a little bit frustrated and wanting to do his own thing instead of just copy his brother all the time. So I think that we started to see a little bit of avoidance of that prompting with that dyad. So I think that's something to think about in terms of helping siblings to decide how often is the right amount, when do we back off in terms of these interactions. The other thing that we looked at was joint engagement. So this again was a % of intervals. We defined joint engagement as the children both playing with the same object or activity, and then the sibling with PH.D making some acknowledgement that their sibling was involved in this interaction. So that might mean looking at them, it might mean exchanging materials, it might mean imitating them during the interaction, so really just any kind of acknowledgement that they were doing something together. It didn't have to necessarily be eye contact. So what we saw is for 4 of our 6 dyads, we saw some increases in joint engagement here. This was definitely less consistent, particularly at follow-up. We really only saw that maintenance at follow-up for 1 of our dyads. And so we saw definitely some inconsistency here. And for Chris, with both of his siblings, we actually saw some significant decreases in our joint engagement during the treatment phase, although for Chris and Kristen, that recovered really nicely at follow-up. My thought on this is that Chris was a kiddo who was very socially avoidant at intake, and that having his sibling in his face all the time trying to imitate him was very tough for him, that he was really avoidant of that. And that interestingly, his older sibling that was working with him, Melissa, had a real hard time with that she kind of was quick to give up, and that persistence, and that really bothered her that he was starting to avoid her. Kristen, on the other hand, was really able to hang in there with him. And that the longer that they did this and the more that he realized that he was going to be given some freedom in this interaction, he wasn't pushed to do anything right away, that actually recovered nicely. And what we saw is that at first, Chris was really avoidant, and as he got used to this new style of interaction, that the interactions really improved here. So I think we need to think about siblings too in terms of how are they able to be persistent, how much are they able to do with this. You'll actually see a video of Chris and Kristen later that I think illustrates nicely the joint engagement that was able to come together, even though we saw this really, this drop with him during treatment. So I would like to show you guys, just to get a little bit more of a sense of what this looks like, a video example. So this is Chris and Kristen. So Kristen is actually one of our younger siblings. She was 8. So I don't think it was necessarily age that was who was doing better, because she was probably our star in terms of being able to really implement the intervention effectively. So this first video you'll see is a brief clip from their baseline in terms of the type of interaction that they were doing prior. So as you can see, she's working pretty hard to try to find something that he wants to do with her, and he's not having anything to do with it. She's played with him enough to know that putting Woody away might help this situation, I think. And as you can see, this is a child who has actually a fair amount of language. You heard him say phones there when she handed him the phone, but you didn't really hear him using much of that language. You heard him kind of singing to himself, but not a lot of real talking here. So this is a video of these same 2 siblings towards the end of treatment. So as you can see, I think that interaction after intervention, it looked a lot more collaborative. It was a lot more interactive. You could see a lot of that imitation. He's using some language. And she's really doing a great job with kind of following along with his lead. Even when he would throw some things out there that she had no idea what he's talking about. He's talking about popcorn, but she's going with it. And that she was really able to get that nice interaction. So what really, my kind of question here was, okay, we're seeing this joint engagement data that isn't really looking very strong. Some of our kids seem to be decreasing joint engagement. We're not seeing very consistent increases, but that across many of our kids that I felt like these types of qualitative changes in interaction were really happening, and that parents were thinking that too. And we all have a tendency as researchers, especially when we're the interventionists, to think that we see changes that may or may not be there. But so we wanted to kind of think of a more objective way to look at, are there some other qualitative changes going on that our joint engagement measure may not be capturing, but that hopefully aren't just in our imagination, because we'd like to see them start to do better after all of this hard work. So we wanted to really look at whether there were subjective changes in siblings' interaction patterns. So the way that I did this was to have undergraduate students from our subject pool at MSU view 2-minute randomly selected video clips. So we took a video clip from baseline and then a video clip that was randomly chosen from the last 4 sessions of treatment. So it was 2 minutes. We just decided minute 2 to 4 of the interaction. We would pull that out without looking at it and show those clips to some undergraduate students. They weren't told anything about the interactions except you'll see 2 siblings playing together. And then we asked them to rate each dyad on 5 questions. So we asked, to what extent does the older child attempt to engage the younger child? To what extent does that younger child respond appropriately? How much is the interaction characterized by imitation? How much do the children appear to be having fun? And how typical does this interaction seem in terms of a sibling interaction? And so what we did is compared those baseline trips versus late treatment clips using a MANOVA. And so we had different groups of students. So each student actually only saw one interaction between the siblings. So they weren't able to directly compare. They just saw one interaction, and they saw some pre and some post. And then a second group of students saw the opposite time point. So we were thinking we don't want them to really compare directly and say, are they better or not? We just want an impression rating. And then we figure over this group of students that we're averaging their ratings together, we're looking for pre-post differences. And so what we saw is that these undergraduate students who weren't told anything about it, they only saw one clip, they didn't know this was a treatment study, they were seeing some subjective changes as well. And that this was just a 7-point Likert scale. So for the most part, we were seeing about a full point difference between our baseline clips and our post-treatment clips across these different questions that we were asking. So there seemed to be some subjective qualitative differences in those interaction styles that weren't maybe fully captured by some of our outcome measures that we were looking at, like that joint engagement. So sort of in the conclusion, the siblings seemed to increase their use of intervention techniques, although there was some inconsistency. Children with ASD were increasing their percentage of correct imitation, and that we saw some subjective improvements in those sibling interactions, even though the joint attention skills didn't seem to be improving quite as consistently. So in kind of thinking about this and doing this study, this really led me to ask some additional questions about what's going on with our siblings as well. And that it was clear that some siblings were better at implementing this intervention than others. As I talked about sort of some of the individual differences, even among siblings working with the same child, that seem to be driven by sibling factors and not necessarily by the child with ASD's behavior. Most of my parents were indicating overall really good sibling adjustment, good sibling relationships, that things were really going pretty well with the siblings, which was nice to hear. But I did have a few parents who had some significant concerns about the adjustment or the well-being of the sibling without ASD, asked for referrals to additional services, to sibling support groups, those sorts of things. So there was some variability in terms of how our parents felt siblings were doing. As kind of coming back to this developmental contextual approach, I really wanted to ask some additional questions about our siblings and how their characteristics and what's going on with them is influencing things. So starting here from our family characteristics, wondering about sibling adjustment and well-being. How are our siblings doing as a group in terms of siblings of kids with ASD? And that we know that our siblings' engagement, their interest in interacting with a child with ASD, that relationship is going to be something that could potentially be important as well. And especially when we're asking siblings to do some intervention, that these factors going on with the siblings are going to impact how they're able to do an intervention that we're asking them to do. If our siblings aren't doing as well in general or aren't as interested or engaged with their sibling, their ability to correctly implement the intervention may be lower. In thinking about, this is something we were doing twice a week with siblings, but we're hoping that they're going to be doing this more often with their siblings in their home environment as well. So certainly these characteristics that are going on with siblings are going to influence how frequently they're actually doing this intervention with their sibling outside of treatment sessions. And then we're hoping that our siblings are going to have an impact on these child characteristics and skills, not just the joint attention and imitation, but also that quality of engagement between the siblings, and then the overall response to intervention. So we're seeing that there's probably going to be a relationship that starts here from sibling adjustment on how well things end up going with child skills as well. And that probably really goes around in a circle, that how well the siblings engaging, how well they're responding is going to have an influence then on how prone the sibling is going to be to want to continue doing that. So I wanted to focus in though on these characteristics in terms of what's going on with siblings right now, and ask the question about what factors might put certain siblings at risk for poorer adjustment. And so we know from previous research that there's at least some research out there indicating that siblings of children with ASD may have poorer adjustment compared to typically developing children, as well as siblings of children with other disabilities. Research has been a little bit equivocal on that. Some studies have found that they seem to be doing fine as a group. Other studies have found some poorer adjustment in our siblings of children with ASD. And that one of the hypotheses about why our siblings with ASD might be having difficulties is that maybe there's something unique about children with ASD, particularly children who are more severely impacted, that's having a potential negative impact on siblings' lives. Maybe they're not allowed to have friends over as often. They're being impacted by behavior problems. They're being asked to care frequently for the child with ASD. That's been one of the hypotheses put forth about a relationship that's been observed between more severe ASD and more adjustment problems in siblings. There's also been research that my advisor and I did looking at maternal depression in parents, moms of kids with ASD, indicating that moms of children with ASD seem to be depressed at higher rates than moms of children who don't have ASD, and that there's a pretty high rate of clinical depression in mothers of children with ASD. And that seems to be related, that children with higher ASD severity are more likely to have moms who are experiencing depression. And in turn, we know from a variety of developmental research that maternal depression often is related to adjustment problems in children across a variety of families, not just children and families with disabilities. There's also been several studies that have indicated that the presence of the broader autism phenotype may be leading to adjustment problems for family members. So by broader autism phenotype, we're thinking about this broader genetic liability that may be associated with autism for things like low-level social problems, perhaps a tendency not to seek out social support in situations where you need coping, perhaps a resistance to change or difficulty coping with change, that are characteristics that we see in ASD, and we're not saying siblings necessarily are having meeting criteria for an autism spectrum disorder, but that they may have a low level of some of these symptoms that could impact their own functioning. So to kind of test this model, what we did is had 70 moms complete questionnaires to measure these different constructs in siblings of children with ASD. So we had them do the autism behavior checklist about the behavior of the child with ASD. The family impact questionnaire, particularly there's a sibling subscale that asks about direct impact of a child with a disability on the sibling. The Center for Epidemiological Studies depression scale about themselves and their own depressive symptoms. We had them do the social responsiveness scale in relation to the sibling, the typically developing sibling's symptoms. And then the strengths and difficulties questionnaire to look at adjustment problems and prosocial behaviors. So what we saw is that we did see a relationship between severity, autism severity on the ABC and sibling adjustment problems, so about 0.27 weight there. In terms of kids with higher autism severity, the siblings tended to have greater adjustment problems. Then when we put these other predictive factors in the model, what we saw is that this maternal depression path was actually explaining 57% of that relationship. So pretty high proportion here. And we did see this, that when there was higher ASD severity, we had moms with greater levels of depression, and in turn, we had siblings who were having more adjustment problems. We also had this relationship dropped out of significance when we put in the full model, and we did see that explaining some of the relationship as well, and I suspect with the larger sample size that this pathway probably would have stayed significant here. So perhaps a slightly smaller impact there, but also potentially some impact through that direct impact on the sibling. We also saw a very strong relationship between the siblings' broader autism phenotype and those sibling adjustment problems, in that our siblings who were having more reported symptoms of autism spectrum disorder were having more behavioral problems overall. That seemed to really be explaining a proportion of this as well. So that overall, what we were seeing here in this is that we have this direct pathway from sibling broader autism phenotype as well as some mediation of this relationship. Moderation is the next thing that we wanted to look at and think about, are there any factors that moderated that relationship between ASD severity and sibling adjustment? So we were curious about whether presence of that broader autism phenotype made a difference here. And so it looked at, so this is looking at our lines here are representing sibling adjustment problems on the strengths and difficulties questionnaire. And what we see is that for our kids who have a low level of the broader autism phenotype, so our kids where parents aren't reporting a lot of those symptoms in the sibling, autism severity doesn't seem to make much of a difference. They're doing pretty well regardless of autism severity in the sibling. However, in this group of siblings where we have high broader autism phenotype, what we're seeing is that when we have high broader autism phenotype plus high autism severity, this is really our siblings who are having a lot of difficulties. And that our hypothesis there is potentially these siblings who are having more difficulties themselves, perhaps more social difficulties, maybe more difficulties with things like perspective taking, may have a harder time coping with those difficulties that their sibling is having, and that's leading to some more adjustment problems for those siblings as well. So kind of pulling this together, we saw a couple of different potential pathways to adjustment difficulties in siblings. One was through this more severe ASD can lead to maternal depression, which then in turn led to sibling adjustment problems. We also saw an additional pathway where more severe ASD plus that sibling broader autism phenotype was also leading to poorer sibling adjustment. And so I think this really just highlights the idea that when we're assessing functioning in a child with ASD, in the parent and the sibling, that this is really something that has a lot of relationships among each other, and that we need to think about assessing functioning in all family members when working with children with ASD, because affecting how mom's doing with her depression may have an impact on everybody. Working on behavior problems in our child with ASD may in turn have an impact on our full family, and that we do see some increased risk for some of our family members that's important to think about. So my next steps thinking here is I'm really interested in these impression ratings as an outcome measure. How can that be helpful in some of our studies? And looking at how can we use some of those impression ratings as important ratings of child behavior. And also thinking about demographic risk factors for siblings of ASD compared to a typically developing sample. Are there other things that we can look at in terms of age, gender, SES, things that might also point us towards families where we may have kids who are at a higher risk to think about assessing more closely? So the next set of studies I'd like to talk about are some studies looking at language in parents of children with ASD and their kids. And so this kind of takes the opposite. Rather than starting with an intervention and moving it into a family, really thinking about starting with what do family interaction patterns look like, and how can that inform the interventions that we develop for kids with ASD. So in thinking here, I think there's a lot of controversy about what the right ways are to intervene with young children with ASD, especially our little guys, about what are the appropriate settings for young children. Should we be putting them in a preschool classroom? Should we be looking at them at home? Should we be pulling them into treatment and doing ABA with a one-on-one therapist? What's the right place for young children to be? Also, what are natural learning patterns in toddlers and preschoolers look like? Do they look similar or different than in our toddlers and preschoolers with ASD? And how can we take that into account when we're thinking about intervention? So then as we kind of come to our intervention targets and style, there's this issue that we have, our behavioral interventions really have demonstrated efficacy for building skills in our children with autism spectrum disorders. We also have some indication that there's some positive impact on developmental interventions for social engagement in our kids with ASD. In terms of our child characteristics and skills that interventions may be targeting, we see speech, engagement, pre-linguistic skills. These things may be targeted across a variety of different types of interventions. And then when we bring family into the mix, it gets even more complicated. We think about parents are being asked to implement interventions. How effectively are they able to do that? How acceptable are interventions to parents, and how is that going to impact their ability to bring children to their intervention appointments, sticking with intervention, working with their intervention providers over time? And so again, these things are all going to relate to one another. We really can't pull one out. But the thing that I wanted to start with here is thinking about parents and what type of parent behaviors might encourage children to use language during play. And as we're thinking about that parent acceptability, if we can start from where parents are already at and design interventions there from what they're doing that's already effective, we may be able to learn something about how to intervene with our kids, and also using information that is appropriate for the developmental context and learning patterns that kids already have. So what we know here is that from some of our longitudinal research, this is a landmark study by Siller and Sigmund, they followed children for up to 16 years and found that children whose caregivers used more of what they called caregiver contingent comments, which is basically language that followed the child's interest without making a demand on the child to change their behavior. Those kids had better language outcomes up to 16 years later. So that's a pretty powerful period of time that how parents are talking to kids at that age may impact their development much, much later in life. In contrast, our treatment studies seem to indicate that there's the greatest research support for primarily behavioral interventions. Our early intensive behavioral intervention, some of our naturalistic behavioral interventions, and really the types of language, if you break it down, that we're using with kids here is a lot of prompting, which is not at all like caregiver contingent comments, that we're asking kids to do a lot of things. We may be following their interests, but we're certainly making demands on them to do different things. So my question is, how do we reconcile these two things? How can we look at how parents are interacting? And does this really seem to be the case in a one-on-one current interaction, that these caregiver contingent comments are what's promoting language among parents and children? Or Are these more types of behaviorally oriented strategies like prompting kids to use language also something that we're seeing parents doing effectively? And so what I was interested in doing is looking at a microanalysis of an immediate conversational context between parents and children. So rather than looking longitudinally over a long period of time, say what's happening in the here and now? What do parents say that elicit language from their children right at that moment? I was interested in looking in both a group of kids with ASD as well as a group of young children with typical development, because part of what I wanted to ask is how typical are these language patterns for what parents are doing with their toddlers anyway? Is this something that's developmentally appropriate across a group of toddlers? And I was interested in looking at several elements of maternal language. So one was, how did maternal language relate to the child's focus of attention? Were they following the child's interests, or were they trying to redirect the child to something else? To what extent were the parents making demands on the child? So were they prompting them to do a particular skill? Were they asking them questions? Or were they just describing what was going on in the play context? And then I was also curious about orienting cues. We know that our kids with ASD have a tough time with joint attention, with following the prompts of an adult, responding to their name, paying attention to social cues in the environment. So I was curious whether when parents were providing additional cues for their child to attend to what was going on, whether that was helping kids to use more speech within their play context. So what I did is had a 10-minute videotaped mother-child interaction. And I went through and identified all of the times that a child made an appropriate utterance, and then also control points in the video. I'll talk about that in a bit. And then what I did is went backwards and found out what was the maternal utterance that immediately preceded that point when the child spoke. So rather than starting from what mom did, I said, okay, well, this was success. Our child said something appropriate. Now what happened just before that? And so the way this looked, so for example, if this is 2 minutes of an interaction, the first thing we went through is just found control points every 30 seconds. Those were predetermined at what point we were going to put that in. And so the idea of this was to control for the type of language that parents are using more often anyway. So for example, if we have a mom who's using 80% demanding language, and then we go and see that prior to when the child speaks, 80% of the time it was demanding language, well, that tells us next to nothing, because that's just what it would be by chance anyway. However, if we see that before child points, that mom's using 80% of the time demanding language, but throughout random points in the interaction, she's only using that language 20% of the time, that tells us much more that that type of language may actually be promoting the child speaking during the interaction. So we kind of went back up to 10 seconds here to find what was the maternal utterance closest in time to that point we identified. And then I did the same thing with finding all of the places where the child spoke appropriately, and again, finding the maternal utterance that most immediately preceded it. So the way that we then categorized maternal language was kind of, it fit into one of 4 quadrants. So follow-in versus redirecting was basically whether was mom talking about something that the child was already doing, already engaged in, or was she talking about something different from what the child was already engaged in. And then demanding versus non-demanding. Demanding was basically asking a question, prompting the child, making any type of demand for the child to do a particular behavior. Whereas non-demanding, things like just labeling what the child's doing, labeling objects or actions in the environment, narrating play without making a demand on the child. So this is just a quick demographics of our sample. We had 28 kids with ASD and 16 typically developing kids. We initially matched on cognitive age equivalent, which we did a good job of, but then unfortunately our typically developing sample scored quite a bit higher on our language measures than our cognitive measures, so we would have loved for them to be matched on language skills, but we did see our kids with ASD having slightly lower language skills than our kids with typical development. So you'll see throughout this that we controlled for the total language age equivalent on the PLS to attempt to control for that slight difference in language skills across our groups. So the first outcome I was interested in looking at is what of those 4 main categories of maternal utterances seem to best elicit child language. So what I wanted to look at first is what type of language are moms actually using with their kids. So this is just those baseline points, those every 30-second points. What types of language are moms using before that? So what I saw first of all is that this follow-in language, both across demanding and non-demanding, moms are doing a pretty good job of following their children's interest during play. So the gray is our kids with ASD, the red is our kids with typical development, and really across both groups, our moms are really following the interests of their kids during play. In particular, I thought it was interesting that this follow-in demanding language was a very highly used type of language. So this is basically following a child's interest and asking them to do something during play. One of the biggest concerns that has been expressed about parents being taught behavioral strategies during play is that this isn't how parents and their kids naturally interact. And in fact, based on this is how parents and their kids naturally interact. These are typically developing toddlers. We just brought them in and asked them to play together, and moms are asking them lots and lots of questions. So really, this is a pretty typical play pattern between moms and their toddlers, both typically developing and our kids with autism. So let me orient you to these graphs a little bit. This is looking at the different types of language that moms use that promoted language use in kids with autism. So this whole side is ASD kids, this is typical kids. And what we did is we calculated a percentage difference between whether this type of language was occurring before child points versus before control points. So what that ends up meaning is that 0% means that it happens equally often between those child language points and control points. A positive number indicates it's more likely to happen before those child language points than control points. So we're thinking of anything in the positive as potentially promoting child language use, and things that are in the negative as something that it kind of discourages child language use. It's not likely to be followed by child expressive speech. So what we saw is that for both of our groups, the type of language that was most likely to be followed by child language was, again, this follow-in demanding language. So when parents follow their child's interests, prompt them to use language, ask a question, make a demand. That for both of our groups, this is really what's helping our kids to talk during play. And then yeah, go ahead.
That's responding, right?
Yes. So, well, it's set up to be responding, although the way that we coded it, it could potentially be a behavior that's leading them to initiate too. We didn't specifically code child language as initiating versus responding. We just looked at the child talked, what happened right before the child talked. So it's possible there were nonverbal behaviors that mom was doing in that interim. If we didn't see her say anything in 10 seconds beforehand, then we didn't code that. But I'm going to be honest, I think that if we had gone through thinking about our sample, our kids with ASD were not doing a lot of initiating. So I think even if we'd pulled initiations and responses apart, I don't think we'd be seeing many initiations. But I think you have a good point. Initiating may be more promoted by certain nonverbal behaviors as opposed to these verbal behaviors. So then my other question was about these orienting cues. How does that influence language use in our kids? So I coded an orienting cue as any additional cue that a mother gave when she said something to orient. So it could be saying something like look, saying the child's name. It could also be touching the child, taking a toy from them, blocking their play. I initially coded these things all separately, but the rate of occurrence of each particular behavior was low enough that we weren't really able to look at them separately, so I ended up just clumping them all together and saying, okay, did they use an orienting cue or not? So we saw is that when moms were trying to redirect their child's focus of interest, moms for both ASD kids and typical kids did this pretty often, which makes sense. They're trying to pull their child's attention to something new. Interestingly, even when they were following their child's focus of interest, our moms of kids with ASD were still doing this a lot. Our moms of kids with typical development were not doing many orienting cues when they were already following their child's focus of attention. But our moms of kids with ASD were. My thoughts on that are that our kids with ASD are not very good at attending socially to what's going on in a context. So even if mom's talking about the play that the child's doing, she may be doing something else to try to get the child to pay attention to her and not just to the toy. So this is, again, similar to that graph we saw before. The positive is going to indicate more likely to promote child language here. So what we saw is that for our typically developing kids, orienting cues really made no difference. Over here, this is now one or more orienting cues. For our kids with autism, when moms were using orienting cues along with their speech, they were much more likely to respond verbally to what mom said, so that for our kids with ASD, those orienting cues really made a difference, which I think makes sense given that we know that kids with ASD have some significant deficits in joint attention and have difficulty following another person's focus of attention. So I think our implications for intervention here are that prompting during play really is a developmentally typical strategy for typical kids as well as kids with ASD, that this isn't some unnatural thing we're asking parents to do, it's something they're already doing pretty often. I think this is pretty consistent with the naturalistic behavioral intervention philosophy of following a child's lead and then prompting them to do something additional. And that we're seeing these orienting cues may be particularly beneficial for children with ASD. So I'll go through pretty quickly here so I can conclude here. One of the things I'm interested in is looking at time course here. This is looking at immediate conversational context. Are these the same things that are promoting language down the line? It's hard to say from a study like this, that we're seeing some contrast between those longitudinal studies and these more immediate studies, although there are a few things that have come out since then that have indicated some benefit for this kind of follow-in demanding language over at least a period of about 6 months to a year, but a lot of that research has yet to be done. I'm also interested about the relationship of these utterance types to more established member types of parent-child interaction quality measures. Yeah, it's nice to sit here and go through the entire video, but this is not something a clinician would be able to do, to say, okay, well, how are mom and child interacting, and how can we use that in working on interaction patterns between our mom and child? So think about some of these measures, like, for example, the Piccolo. It's a new one that's come out in terms of parent-child interaction, and a number of other things. How does this look like? How do these behaviors map on to these more user-friendly measures? So I want to conclude by talking a little bit about my thoughts on how this approach to intervention can better inform intervention development for kids and their families. I think this is helpful in tailoring interventions to be most appropriate to children and families. We need to think about the family's interest in this and how they're already interacting with their kids, what feels natural to them, as well as what we know is effective in our therapist-implemented interventions. I think explicitly considering the needs of the whole family when we're developing interventions is something that's important. And also informing interventions that are appropriately tailored to the needs of very young children, thinking about how our parents and children are already interacting and what are the most appropriate settings for our little guys. So in pulling this together, I think we need to think about the child with ASD, obviously. This is the main person that has started this whole intervention in the first place, is that we have a child with ASD who's needing some intervention. Their skills, behavior problems, how they're responding to intervention, how they're engaging with others. But that also we know what's going on with them is going to have an impact on our family well-being. Stress, coping, their social support, their mental health. I'm sure you guys all who are clinicians have worked with parents who are just so overwhelmed that asking them to bring a child into a very frequent or very intense intervention, you just know that's not going to be realistic for this family right now. I think then thinking about those components of the intervention, the family involvement, their investment, how acceptable it is, their time required, that's something that's important as well. And then how this impacts family relationships, all different types of family relationships, parent-child relationships, those sibling relationships between parents, as well as those full family interactions, and really taking into account all of these quadrants when we're thinking about developing interventions right from the beginning. So my next steps that I'd really like to look at is thinking about these sibling-mediated interventions. What might be some other possible delivery mechanisms here? A group intervention, having some increased parent involvement so that we're teaching parents and SIBs at the same time. Whether combining this with a support group of some sort would it have an additional benefit for everybody. Also, evaluating some other impacts of using sibling-mediated interventions. So not just looking at what's going on between the two SIBs, but are we seeing differences in things like sibling relationship or sibling adjustment over time as interactions between the siblings become more positive? And also looking at parent-child interactions and intervention. Thinking about, is looking at a standardized measure of parent-child interaction something we need to be doing as a standardized part of our intake process? What information can we get from that? How does that inform what the next step is with the child in terms of how they're interacting within their family context? And I think that thinking about, this is a kind of different tack, but I'd like to think about that developmental time piece a little bit more too, and thinking about how effective can these interventions be with populations who might be at different ages, different developmental levels. We have a real lack of interventions focused on basic social skills, and for example, our adolescents and young adults who are very severely cognitively impaired, who may have real difficulty interacting in any way, but we don't know what the right things are to do with them because there's so little research on what promotes good quality of life, good social engagement in those individuals. And that I think that there's some indication that there's some promising directions for using some of these early intervention type of strategies with older individuals who have severe impairments to promote better interactions between them and their caregivers. So wanted to acknowledge my collaborators at Michigan State, my graduate mentor, Brooke Ingersoll, obviously the families who participated in all of these studies, as well as my funding sources, Organization for Autism Research and Autism Speaks. So thank you very much.